Afterwards, apnea. Seizures, convulsions, and then rapid breathing, and then when I signal to you, apnea, and breathe, apnea, no convulsions, apnea, and la telecamera è qui, quindi
là, cioè vicino al tavolo lì.
Sorry, can we sit there?
What?
Can we sit there?
Can you see it?
Can we sit there?
Poi se no mi sento schiusa.
l'altra vedere questa, l'altra
Questo è 20 anche se non l'avessi spesso anche se non me l'avessi
we're just waiting to figure out the video. So he's video taping scenario, and then there's a projector, there's a TV, should be able to see it. So
set this up.
yeah, just try to get it to connect to the TV over there. And then the problem we also have is that people tend to stand in front of the bed and watch the video. So that's having Can I just alert you? The video is right there. Okay. If they're trying to do it. So if you're like standing at the foot of the bed trying to block the video, and you want to see other people won't be able to see it.
Okay.
Sta registrando ma non si vede il dato, sta sistemando tutto il tempo. Sì, si è fatto del becco, quindi è stato più ok. Just waiting for Sarah to come back as the interpreter, because when you start speaking, she needs to be able to tell us what's going on. Are you guys comfortable with English? Okay, Sarah. If you need something translated into Italian, Sarah is going to help us. And also, when you talk to the mom, if you need to go into Italian, just ask for Sarah, because Daniela is the grandmother of this. So S-bar, the situation is we have a 5-year-old child who is brought into the your emergency department. The background is the child had a fever and comes into the emergency department with a seizure, moving. Sometimes the seizures are very fine and sometimes they're real convulsions, okay? And the grandmother is here and she's very worried, okay? And now we ask you to start, and we have the child who is seizing and has a lot of secretions.
Ok,
Go.
ok ragazzi, il bambino di 5 anni è arrivato in convulsioni in atto. Per favore mettiamo in posizione laterale di sicurezza. Vedete, parti con la valutazione se le vie sono
Le
ferme.
vie sono ferme.
The airways are open.
A lot of secretions.
Okay.
And,
Ok, dobbiamo aspirare un
I
attimo.
posti di secrezioni.
Poi per favore vai a parlare con la nonna, inizia a tenere con calma, magari tira fuori anche un po' dallo scenario, poi vado ad allontanare un attimo mentre noi restiamo. Ok, everybody's clear now? After we aspirate?
a little here, but he still has cyanosis.
Ah, cianosi, iniziamo ragazzi con l'ossigeno subito al 100%. Iniziamo sul tavolo, per
Una
favore.
maschera protettiva.
He's still seizing, right?
Still seizing.
Posiziona la vedella.
Still seizing. You can see he's still seizing.
Una maschera di vedella.
Ok. He's vomiting. Sta vomitando con gli Ok, ragazzi, andiamo avanti con la valutazione. Tu preparami per fare 0.1 muscolo, ok?
Saturazione fondamentalmente.
Abbiamo iniziato adesso con il 100% di ossigeno, andiamo avanti, per favore.
And he's a healthy boy.
Symmetrical lung sound.
With fever.
Senti?
Only
Ok,
with fever.
ok,
Yes.
okay.
Distress.
And he's vaccinated.
How's the
Deep breathing
Had
and
breakfast this morning.
rapid.
Ok, respirazione profonda.
And allergies to something.
Ok, 40 di frequenza respiratoria. Ok?
So now the doctor are taking care.
Sentiamo, proviamo a mettergli anche un accesso venoso, ok, arriviamo alla C ragazzi. Anche la valutazione.
Okay.
2 seconds.
2 seconds, okay? Pulses, peripheral, li prendo bene, ok? La temperatura dell'estremità.
Ok, extremities, cold or
Warm.
ok?
Hot.
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 Ok.
Ok. Segni di precarico.
Renal signs.
No?
Keep you low.
Hepatomegaly or jugular distension, no crackles. Ok.
Prendo l'accesso periferico in pressione sinistra.
Ok, ok.
Still seizing.
Okay,
Still
seizing.
Still
No,
seizing.
getting Dazolam 0.2.
Daniela, still seizing.
1,8 mg di midazolamento vena.
No,
Per 30 secondi.
Torno da lei. Vi volevo dire sulla canzone.
Keep going with the first evaluation, scusate, andate avanti con la prima valutazione, facciamo pupille di glicemia, poi facciamo partire gli esami, ok? Tutti per la prima stato di
It
coscienza.
looks like he stopped seizing.
Ok.
Stop, ok. Stop. Non state facendo.
Finiamo la
But
prima
it's very
valutazione.
blue. His lips are very blue.
We should start ventilating.
Yes.
Please take the diagnosis.
Ok, what about diuresis? Urination sono maschere.
His hands are wet.
Ok, inizio a ventilare. Ok, pupille.
159 di
She has to check with me.
ragazzi a
Ah,
70
ok, you're ok.
Sto ventilando?
Raga, ma cambiano le pupille.
No, non cambia le pupille. Ok. So the pupils are curls.
They're equal and they're reactive. But he's not moving or responding too much.
He's not responding. Can you check that he's not breathing also?
I don't know, check.
Sento il polso.
Ok, time out guys. Stava convulsivando a 150 su 89 di pressione e alterazione della respirazione. Potrebbe avere un'ipertensione endocronica. Quindi, innanzitutto abbiamo un accesso venoso periferico, facciamo partire tutti gli esami per l'alterato stato di coscienza.
Tossici,
Esatto. Appena arriviamo anche alla E capiamo se avesse pure la febbre, in caso facciamo partire pure un'emocultura. Chiediamo un emogas, poi facciamo i tossici. Ha una storia di epilessia, possiamo chiedere alla nonna se prende dei farmaci
Solo
cronici.
convulsioni febbrili.
Ok, quindi non ha una terapia in cronico, quindi non dobbiamo cercare farmaci antiepilettici, cerchiamo un attimo di stabilizzarlo un pochino e la saturazione è migliorata, finiamo la prima valutazione e voglio vedere anche l'exposure.
gli esami,
Stato di coscienza,
glicemia, emogas
A più, e di più,
Sorry.
e di più, right now.
So not responding to voice or to stimulation.
ok.
But he stops.
Ok.
He stopped seizing.
Ok, glicemia,
Next, glucose.
160.
ok, temperature,
39. Ok, allora fermato un attimo, facciamo partire pure l'emocultura. È un
Gli
bambino
esami
febbrile.
che sono compresi di tossici e di ammonio, faccio anche l'emocultura e anche l'inocultura.
ok, exposure, exposure, what I see,
Just hot,
Okay.
and warm, normal skin, no rash,
Okay.
no injury.
also in the back, it's the same,
Same.
ok.
Piccolo recap, un bambino di 5 anni portato per febbre in convulsione, in corso di convulsione, che si è in stato di male, che si è risolta dopo una singola dose di midazolam. Dal punto di vista degli altri dati abbiamo che è un bambino febbrile, per cui abbiamo fatto partire gli esami e l'emocultura. Io adesso vorrei chiedere un lega e poi vediamo di fargli partire anche un antibiotico e un antipiretico.
I don't understand what's happening.
Ok, can you please start to get the grandmother and explain what is happening? Thank you.
Okay,
Time out.
that's time. Time. Good.
Okay, so we stop
Time.
the seizure.
Okay.
But now is non è in buona fede di coscienza. Ok, è ancora permane un'alterazione del suo stato, non risponde, quindi stiamo cercando di capire se tanto la febbre.
His state of consciousness is not 100%, he's still unconscious, he's not responsive.
Quindi adesso stiamo cercando di abbassare la febbre, far partire un trattamento antibiotico dato che aveva la febbre e gli esami del sangue che potrebbero darci delle risposte in più. E intanto continuiamo a supportare i suoi parametri vitali.
Okay. Now, what is your name?
Yeah.
Greta.
Mhm.
I want you to give an S bar to the ward. The ward has called to say we have a patient in the emergency department. An S bar in 30 seconds. Only 30 seconds. Okay? You in English or in Italian? Italian. Okay. Ready?
Ok, allora, bambino di 5 anni ci è arrivato al domicilio febbrile in corso convulsione, per cui ha posizionato accesso venoso, abbiamo fatto il primo midazolam, quindi prima linea, da cui ora è incosciente ma non sta convulsivando. Abbiamo fatto partire batterie esami comprensivi di emocultura, urinocultura, EGA e parte tossici per quanto riguarda l'alterato stato di coscienza e convulsioni. Ventilato per comunque quadro di cianosi e verosimile anche ipertensione cronica.
30 seconds. Let's repeat and finish in 30 seconds. The big things. S, E, A. Okay?
Va bene.
Right.
Quindi bambino di 5 anni, convulsioni in quadro di febbre, stoppate da prima linea, quindi midazolam endovenoso, ha in corso esami comprensivi di tossici parte metabolica, urinocoltura e emocoltura, ventilato per quadro di verosimile ipertensione endocrinica per cui era cianotico bradicardico con ipertensione, FiO2 100% per saturazione non ottimale. Quindi raccomandazioni, insomma, monitorare lo stato di coscienza e se eventualmente ripartono le convulsioni e impostare una terapia antibiotica visto il quadro febbrile anche in base agli esami.
Okay, good. Okay, so now you guys go back. Don't talk to the other group. Yes.
Okay.
And then the other group will come in. Then we'll go into the debriefing room and we'll discuss the case. Okay. Very good.
I think the next one.
Can I just ask them where it hurts? Okay. They said that they're
How are you guys with English? Okay, so you know you can use Italian. Sarah can interpret for us if you need some information. Okay. Are you guys ready or you need another moment?
I think you will be like this. So I'm the team leader. I can stay.
Yeah, try not to block the video if
Okay,
you can.
so
if the
I
team
can
is-
stay.
Yeah, it's better this way. Yeah,
This is
yeah.
okay?
Yeah, it's fine. It's fine.
You can hear me well if I speak like
Yeah.
Okay.
Okay. Okay. And then you're observing.
Yes.
Okay. Can you please sit down and just very quietly and no motions, no coaching. Yeah. Okay, we start with a little Espar. This is a 5-year-old child. His grandmother Daniela brought the child and the 5-year-old child because this morning after breakfast he had a fever and started to have a seizure. And he's now still having a seizure.
Okay.
He looks a little blue and has a lot of secretions.
Okay.
Okay? Okay, and you're in the emergency department and you've come down to evaluate the child who has a seizure.
Ok.
Okay.
Possiamo
Okay.
Ragazzi, quindi mi hanno chiamato, sta per arrivare un bambino che ha delle convulsioni, quindi siamo pronti. Ale, mi aiuti col monitor, Franci, cardio, vero, via aeree, Emi, farmaci e tutti i tempi. Siamo pronti per accoglierlo, quindi siamo nell'area calda del pronto soccorso, il bambino è incosciente, giusto? E sta convulsivando.
Sì?
Conscious?
No.
No?
Unconscious.
Ok, ragazzi,
preso l'accesso,
con calma, posizioniamo
piega, esami, tematici, provo,
Ok.
funzionalità
Past is present.
Con calma, ragazzi,
Ok.
la nostra priorità è somministrare il midazolam, quindi
prendo midazolam, 0,1 mg chilo, midazolam pronto, abbiamo l'accesso?
No yet.
No IV.
No IV. And how much is weight? How much?
How much is the weight?
ok?
Do it.
0,1 mg chilo,
Grandmother.
ok? E ragazzi, se non riusciamo a prendere un accesso venoso, prepariamoci una somministrazione endorettale, va bene?
Ok,
Di
sì.
diafragma endorettale 0,5 mg.
Sì.
Proseguiamo
Ok.
con l'ABC.
Esatto,
Ok.
andiamo avanti con
A.
adesso mentre Emilio somministra, cominciamo. Via aeree come sono?
Airways. Secret.
A lot of secretions.
Ok,
and
Ok, quindi
saturation
aspiriamo le
and
vie aeree.
Inizio ad aspirare.
Ok,
Ok.
Midazolam rettale fatto.
Perfetto.
Ok.
The breathing.
Allora ragazzi, A, quindi posizioniamo anche una cannula di magno perché le vie aeree non sono pervie ma non sicure.
Una
Dopo aver
cannula di
aspirato.
gel, per favore.
Poi ragazzi, B,
Perfetto.
quindi abbiamo detto
Aspettiamo.
con calma ragazzi, B, l'espansione, fatemi la B.
Allora, murmure presente, espansione simmetrica, saturazione 71, quindi per favore una maschera non
Perfetto, la
rebreathing.
maschera non rebreathing.
Maschera non rebreathing.
100% di ossigeno con maschera non rebreathing.
Mentre noi andiamo avanti con la C, ok? magari chiediamo alla nonna che cosa è successo nel frattempo. Franci, aiutami con la C. 160. Ok, quindi è tachicardico ma sinusale. Aspettiamo una pressione.
Il refill.
2 seconds.
2 seconds, ok.
39 di temperatura.
Ok, va
Ok,
bene.
ragazzi,
Polsi
quindi
sono presenti, polso periferico, Franci.
ok, ragazzi, abbiamo un bambino quindi, dal punto di vista della coscienza, un bambino incosciente che sta ancora convulsivando.
So convulsions?
Seizures.
Is it still convulsing? Or
We
just
mean,
seizures?
yeah.
I think he's still seizing, yes?
No. Ah, yes, the head. Ok.
Ok, l'accesso venoso l'avevamo posizionato.
Non eravamo riusciti a prendere perché diazepam rettale.
Ok, quindi se non abbiamo ancora un accesso venoso, riproviamo a prendere l'accesso venoso, altrimenti somministriamo un'altra dose endorettale.
Do you have an IV?
Ce l'abbiamo?
No,
No?
We try second,
Quindi secondo
second IV. Can we get?
Now you have the IV.
Perfect. Okay. So
Perfetto, quindi somministriamo il secondo midazzo.
Io
How
inizio.
much? How much?
0,1 mg chilo.
How much? The nurse wants to know how much.
Quanto
guida la
pesa?
mamma, quanto pesa? 5 anni, 19
5
kg
anni,
sarà.
pesa all'incirca
19
ragazzi. Esatto, sì.
0.1 mg per kilogram for 19 kg.
How much?
1.9 mg of midazolam. Heavy, done.
Perfetto, ragazzi, nel frattempo che ci informiamo con la nonna, le pupille come sono? Finiamo un attimino la D.
Allora ragazzi, per il resto lui ha la B ancora 86 di saturazione, quindi inizia a ventilare con l'amo, ok? Ventilation because it's 84. Ok.
Ok?
He stops seizing.
Ok, quindi ragazzi prendiamoci un secondo per fare un recap mentre ve lo leggo. Stiamo trattando un bambino con una crisi convulsiva, per cui abbiamo incosciente con una crisi convulsiva. Abbiamo somministrato 2 dosi di diazepam, una dose di diazepam endorettale e una endovenosa perché nel frattempo abbiamo preso un accesso. Lo stiamo supportando dal punto di vista respiratorio perché la sua saturazione non era ottimale. Mi occuperei adesso della E. Ha rash da qualche parte?
Does he have any rashes on the skin?
No? Ha la febbre.
Io preparo il paracetamolo.
Non ha allergia, una storia di crisi convulsiva in febbre, non è il primo episodio, la nonna ha mangiato a colazione, poi ha avuto una crisi, la nonna ha dato una tachipirina per la febbre. Ok? Quindi ragazzi,
So no allergies.
A che ora?
a che ora è la tachipirina? Ok, alle 7. E di che ore sono adesso?
What time is it now?
Now it is 10:10.
Ok,
Non possiamo.
quindi possiamo dare
Chiediamo se è allergico all'ibuprofene, se l'ha mai preso. Non ha allergie.
Ok, pesa 20 kg, 10 mg chilo, 200 mg di ibuprofene, abbiamo la via venosa, sono pronto, somministro ibuprofene, 200 mg. Fatto. Yeah, ibuprofen. Okay, 10 mg per kilogram, 20 kg, so 200 mg of ibuprofen.
Ok, ragazzi, prima noi avevamo chiesto un
Let's stop.
Ok.
Okay. Scenario then. You can't stop. Who is the recorder? Who is recording? Okay.
Ok.
Your name?
Federica.
Federica.
Yeah.
Relax. S bar.
Yeah.
30 seconds. 30 seconds.
Okay.
Quick S bar. Situation, background, assessment, recommendation. We're calling the ward to tell them we have a patient. Okay?
Ok.
Okay.
Ci hanno chiamato per un bambino di 5 anni che aveva una crisi convulsiva, è arrivato incosciente, per cui abbiamo somministrato una prima dose di diazepam rettale perché non abbiamo reperito subito un accesso venoso, dopodiché l'abbiamo reperito per cui abbiamo somministrato una dose di midazolam per via endovenosa. Per saturazioni cioè al di sotto della norma abbiamo somministrato ossigeno iniziando con una maschera non reversibile al 100% e per la febbre abbiamo somministrato ibuprofene in quanto aveva assunto il paracetamolo 3 ore fa. E poi abbiamo iniziato a ventilare.
Raccomandazioni.
30 seconds, yeah. Can you do it in English now?
Yes.
Okay.
Okay.
Just a little
Okay. We treated a 5-year-old baby with convulsion, and he arrived unconscious. So we did diazepam, endorectal diazepam, because we didn't have an endovenosa chest. Then we keep an access, and then we give midazolam by the access. For the breathing, we do no rebreathing with oxygen, and then we started to ventilate because we don't have a saturation. And for the fever, we administered the ibuprofen.
He's just not been right all day, just laying around.
Okay, 5-year-old. Do we know the weight of the
20 kilos.
20 kilos.
Okay.
Alright guys, a 5-year-old oncology patient, 20 kilos, is coming for alteration with the mental status. It's a baby, the child already on the table, already here.
The baby's on the table.
Alright. Is he conscious?
I don't know. How are you assessing that?
Oh, I'm okay. Hello, can you hear me? Okay, I'm not great. Is it good? What's your name? What's your name?
Can you squeeze my hand?
Yep.
His name is Tony.
Is he breathing? Slight rise of the chest.
Yeah.
Do I hear any audible sound with breathing?
You need to listen.
No, not with the audible from the mouth. Okay, it's right. How's the body color?
The color is okay.
Okay, pink. Okay, guys, start with the ABC, monitoring, and then you can get an ID access.
Yes.
Does he have already?
He comes with a Broviac.
Sorry.
Central line.
Okay, central line.
Okay.
Can you see something in the mouth? Secretion.
Airways open.
Airways open. Okay. The respiratory rate?
39.
39. Okay. I see retraction or other sign of distress?
Not respiratory distress. Breathing quickly.
Breathing? Okay.
40.
Okay.
Yes.
The ankle is symmetrical and I don't feel sound.
Okay, let's put him on 100% oxygen.
Okay. We put
okay, let's see whether the saturation comes up.
It says he feels nauseous, like he has to vomit.
Okay. Can you prepare for the hour ambulance?
Can you pass the hour?
Put him on the side. Is a parent here with the baby or is it okay, aspirate the young cow. Okay. Let's check for the circulation.
There's a good pulse.
Yeah.
Weak.
Yeah, weak.
Tap refills 5 seconds.
Okay. Seconds. The blood pressure is.
Yeah, we check another one. Okay, one.
It's low for the age.
Okay. So we have a hypotensive shock. Yeah. He has a central line, so maybe sepsis due to the catheter. Did you get the IV line?
No, I am going to draw some blood cultures from the central access, and then I'm going to put an IV access to draw blood cultures.
In the meanwhile, then Chiara, can you help prepare the 10 ml per kilo?
I already have
200
milliliters or so of lactated vinegar prepared.
Okay.
200 of lactated vinegar?
Yes. Like get around 10 minutes.
Is there
acromegaly or okay.
No hepatomegaly and no JVD.
Flavia, can you get a timer for 5 minutes so we can check again for the responsiveness? Okay, let's get for the D while the bolus is going.
I also got
I checked the
For the pupils, pupils are reactive, central line, normal size, inflammation indexes, and a blood count. For if I call him, he responds when I call him or not?
No, sleeping.
Okay, sleeping. And when with the painful stimulus?
And from the line,
Did you check the pupils? The pupils are normal. Okay.
She's drawing blood from the central blood.
Yeah, she got blood.
She got blood and she's trying to put a peripheral line in. Does she get that in?
No.
No, get a peripheral line.
No.
Okay, let's try to get an IUX.
Yes.
And the nurse asks, if the line is infected, should we give the fluids through the central line, or should we?
Yes. Did you check if it works?
Yeah.
It seems to be working. It's a little bit stiff, but it works. It does.
Does he have any?
Silent
No.
on the side effects.
I don't know.
Okay.
Yeah, on the skin.
Okay, let's do the fluid bolus there, then they get an IU access.
Okay.
So the D is fine. Can you get a glycemia, Chiara, please?
Yeah, of course. We
Okay.
Do we have glycemic sticker? The results?
The
glycemia.
It takes 60 seconds for it to run. It's running on the machine.
Okay. We have to wait.
We have to wait 60 seconds for the result of the blood glucose.
120.
Okay, let's go to the E. Nadia, can you talk with the parent?
Can I get temperature?
Temperature is at 36.
Oh,
Yeah.
okay.
Okay.
Does he have any signs of the skin, like lesions,
Petechia.
Petechia.
He got chemo last week.
Okay.
Okay.
We'll ask her. Yeah, Savia asked her which kind of chemo he got.
Okay.
What kind of chemo?
He's on the
We'll wait for Flavia to come back, then we'll stop for 10 seconds and reassess. In the meanwhile, we want to check the circulation again since we are doing the fluid bolus.
Make the blood pressure lower.
When you say okay,
The central pulses. The central pulses. Blood pressure.
Because if he ever gets sick, he needs to get more steroids.
Okay. That's the rapid time.
We just told us
The rapid time.
Capillary
rapid time.
I'm going to do like thing and then yes, and I managed to that. Yes. I'm going to draw my from here as well.
Okay, the blood pressure is lower. How's the breathing? It's still very superficial breathing.
Accelerating
Let's get the
accelerate the body. Finish the bolus by hand.
By hand, you're gonna push it by hand.
the
And you
extremities.
get how much so far?
We did 200.
200 in 5 minutes, but I'm going to push the rest of the fluid by hand.
Yeah, okay.
Okay, Flavia, let's stop for 10 seconds to reassess.
Okay. The boy is under chemotherapy. He takes chemotherapies and he handed the steroids 2 weeks ago.
Okay.
And the medical said to come to ES when the fever will off. No allergy,
Did
no
he have any fever in the first days?
Yeah,
Pressure.
Okay. Okay, so we are all on the same page. It's
Heart
like
rate
a
high.
septic shock,
Yes.
hypotensive.
Yes.
We are doing the first bolus. We need to do another one.
Yeah.
He's not responding
Yeah.
well. We need to call PQ for the likely inotrope support. The saturation is not well with the oxygen, so maybe prep for some ventilation.
Okay.
We're still waiting for the blood gas. Chiara, can we get the blood gas?
7025 negative 12.
Okay. And sorry, the ions in the blood gas? The electrolytes.
Now we're 5 minutes from the start of the body. Yeah, but I finished it by hand, so I'm going to.
We need to reassess and then do the things. Okay. Prepare the next bolus.
Yes.
Prepare for the high flow nasal cannula. we need to do, we call PQ, Flavia, you call PQ. Anything else we miss? We already did the blood culture. We need to prepare the antibiotics. He's an oncologic patient, so maybe Chiara, can you check for the guidelines for the oncology antibiotics? Anything else we might have missed?
Okay, time out.
Okay, great job.
Yep. So can you do a 30-second SBAR? You're going to call the oncology floor because you're done in the clinic. You need to admit him to the hospital. So 30 seconds on what they should know.
Okay. We have a boy that you know, 5 years, 20 kilos, verosimile hypotensive and septic shock in infection of CVP. They come to CBC. They come to with the fever, and they ended the spirits 2 weeks ago. We supported the airways with mask, and it was in hypotension, so we done a bolus of 2,000 milliliters because the pressure was down, and we started the antibiotic. No, we were prepping the. We prepared the antibiotic. Okay, sorry.
What was the bolus?
10.
Yes.
How much?
10.
10 per kilo, so we were starting.
So how much did you receive?
They're saying 2,000, but
Yes,
you said 200.
We received it. We have done 5 minutes, so 100 milliliters.
100 milliliters.
We finished.
So how much total fluid went in so far?
Are you asking her or anyone who's available?
Whoever's on the phone.
We need hashtag mLs per kilo.
10 mLs per kilo.
Is 100?
Okay.
Okay.
I was trying to check whether it was the English translation of 2,000 or whether it was...
Sorry, you're a little bit accepted, so the English is not perfect.
Okay. I'm just trying to figure out. Okay, so now you guys wait.
You want us to help clean the...
No, we got that. So then you just wait for a few minutes, think of one thing you did well, think of one thing you could improve, right? And then we'll do the SBAR again in a moment. Okay?
Thank you. Thank you.
Yeah, close the door. Make sure the other team is ready to go. Ready to go? So, you think that's something like that goes with if he said, I'm really concerned that this is central America. Then we could have debated about, there we can debate about whether it is enough. So you can make that decision over there. Especially when I have kids stuff, so I've got to work.
And it took a long time for us to see. Right, like they have to, you know what I mean? Like and nobody has to work. I even went like this. I just don't know. I'm not doing a good job communicating with them. I'm doing like this down, you know, because they're not getting the fluid, they're not getting the blood pressure down. Okay.
Just be aware that if you make the blood pressure go less than 60 over 30, the machine will automatically go to asystole. Because once it doesn't detect the blood pressure and your blood pressure is low enough, it sends it into an arrest right away. So try to keep it. Right? Am I right, Fabio? Yes. So try to keep it like 60 over 30, 70 over 40. Don't let it go down.
And I don't know how to intervene. They're asking me, and then they started.
We have more information, you know, the weight.
20 kilos.
20 kilos. Okay.
I'll be empty.
Okay. I have time to. He's here. Okay. So I wanted to do a quick look. How is the behavior of the child?
My mommy.
Okay.
My mommy.
And
my stomach hurts.
And the breathing. Okay, quickly. And the body color. Okay, so guys, that seems a critical ill child. We need to call for help. We have security conditions. Security conditions to start the evaluation.
Yes.
Okay, we are in the emergency room. Okay, Rita, I'm gonna be the team leader. I'm gonna distribute the roles. Martha, you're gonna be on A and B. Diana on C, circulation, healthy circulation. You D and you E and stop with the fathers. Okay, can you start to calculate the drugs?
So we start with we need oxygen face mask with bag ventilator.
I feel like I have
We
to
don't
throw
have.
up.
We don't have.
I feel like I have to throw up.
Okay. If you want to sit right in the seat.
Okay. Is more comfortable sitting or
On my side, I like to be on my side.
on the side? Okay. Okay. So is the airway packed?
That's the side of my catheter. This one
So
here
there-
is the side of my catheter.
Okay. I will proceed to the evaluation of the B. So we have the A here. I will start by pulmonary auscultation. Pulmonary auscultation.
Lungs are clear.
Lungs are clear. Okay, the peripheral saturation, please. So he has any respiratory efforts?
Yes, really quickly.
Okay, breathing quickly.
40.
Okay, 40, 91% with a high flow oxygen. Yes. Okay. So
You can proceed.
I proceed to the B. I have turned off to that population is okay. Saturation 93% with the high flow oxygen.
I think
we had respiratory efforts
I think you can proceed to C, right?
Okay.
I will check the pulses, the renal and vital one, the reads.
Weak.
They are
Okay.
weak, okay. The capillary perfusion, 1, 2, 3, 4, 5.
Yes, capillary refill is 5 seconds.
5 seconds.
Delayed.
I will check for any signs of preload, like crackles.
I'm trying to have an access, IB access, so I get that.
He comes with a central line.
Central line.
Oncology patient.
Okay, okay.
He's an oncology patient with a central.
Okay, when concerns, we know that he's an oncology patient and he has fever. Maybe it's better to do antibiotics and paracetamol to control the fever.
Okay, let me collect some.
Yes, I need to complete blood count, blood gas, electrolytes, renal function, liver function, coagulation, and blood culture.
Inflammatory markers.
And inflammatory markers, yes.
Okay.
Blood pressure is low.
I'm sending pressure to the laboratory.
Okay, we have another access?
Yes, it's the
You don't have the central
it's
line.
free.
Only
There's
the
a
one,
central line.
and it's free. He's hypotensive, so it's better to do a bolus of saline solution. We have 200 milliliters, which corresponds to 10 milliliters per kilo, right?
Okay, it's fine.
Okay.
Peter, we started
Bolus.
we don't have
Saline solution, 0.9%.
Okay.
Bolus is ongoing.
It's ongoing.
Okay.
The C is okay.
Try another axis when the
Of course,
duration
the peripheral, okay,
right? You can proceed to the D, okay?
Is he responsive? Does he say anything?
He's much sleepier now. He's not asking for his mother, and he's very sleepy.
Only response to
He
pain.
responds to pain, like groaning. That's all.
Okay. Maybe it's better to
Our
call anesthesia, please,
Yeah.
because
Yeah, okay.
About 5 millimeters to 2 millimeters.
Okay.
they already call anesthesia because he has to
Can I try in another case? Do I get one?
Okay. Do we have the blood glucose? Blood glucose?
So,
Blood glucose.
try
120. Okay. 120 blood glucose. Okay.
if you can come we will push it for help.
Why do you need us? Why do you need us?
Because he's not
Okay.
now with the problem.
The D.
What's his
So if we put on normal, he's less responsive in the beginning.
In the saturation?
Before it was 91, like we see now. Right now it's 93.
So now we go to E. We expose the ball. Is there any signs of bruises or marks?
You want me to come back?
Okay.
You want me to...
And fever.
I have a big stomach table. You want me to leave and come?
Do we have a second access?
We're going to try neutrals here, okay?
But we can, right now, the airway is
Airway is fine.
Listen carefully. The central line is Yes, the central line is
Okay, so we can do the
Ceftriaxone 100 per kilo, which is 200 milligrams.
The temperature is
2,000 milligrams. I think we don't have it.
The temperature is the same or is it lower?
Ceftriaxone.
Yes, but we already did per
Can I make one? No. We already did the Olos and Ceftriaxone. I think we put regular paracetamol.
Yes, we already
Yes.
Rita?
We have rental paracetamol to do because we don't have an access.
Okay, so 250 is the closest.
Okay, we can do rental paracetamol.
Can I please strike the Ceftriaxone?
Yes.
2 grams?
Yes. Okay, it's ongoing. Okay. Mariana, have you already talked with the parents?
No, can I go?
Yes,
Okay.
please.
So, we start with
While she's talking with parents, we are starting the ABCD.
I'm sorry,
So, how is the pain? Is patterns? Do you need any abnormal signs? Do you hear any abnormal signs? Do you see any secretions, blood? No. So, I can see him breathing, right? Yep. Okay, I will start again with the pulmonary auscultation.
Sounds clear.
Clear? Okay. So, the respiratory effort is better?
Yes.
Yes. Okay, do we have the 93% of oxygen? And the respiratory rate 40 is still okay. Okay, maybe we maintain the high flow oxygen. I will miss the low.
If you ever get sick, tell the doctors that you might need to.
Okay,
Because it's 93, each hospital is
it's
really quickly, right? It's really quickly. Okay, but because it's fever, it's like you say, let's go to the C. Okay, I will proceed to the C. I will evaluation.
She's getting really blood pressure.
Pulse is still I will check everything. Signs of thrill before, like the virus.
I already think is the new alert.
Correct? I already is enough, right?
Right now, it's okay. It's dropping. The blood pressure is dropping. The first one, okay. Which is the capillary review. Okay, it's still not protected. Another bolus, please. The first one, saline solution. It's running. It's running secondary. We should think about blood because it's this is the second bolus. I think
Okay,
so the blood service.
Okay, I can come back. Can I speak to you? So this is a boy who has
continue the evaluation.
This is a boy who has leukemia and is in protocol, leukemia protocol for his hospital. So the doctors were very call to the oncologist here because the grandfather told me that he did steroids and the oncology doctors tell them that doctors that every time he's this sick, he was supposed to do steroids. I'm not sure. Maybe we can make sure with the oncology team, okay? And besides that, he's a healthy boy. He started even to the morning sleepiness and
we are no allergies,
no other medication.
So we are going to call the
maybe just to make sure. Grandfather also told me that the blood acids usually going
down. Fever.
Okay.
Great job. So who is going to give the sign to the ward?
Who's documenting?
The document is Marianne's.
Okay.
Can you give a 30-second sign out to the ward?
Okay.
30 seconds. As far? Just the facts. 30 seconds.
I can help.
Well, you can also.
Okay.
You can do Italian.
Okay, I'm Rita. I'm
not speaking Italian.
I'm doing
we are Portuguese.
Portuguese.
Oh.
translate
I'm
Portuguese.
useless.
No, go
Sorry.
ahead.
Okay.
In Portuguese, go ahead.
Okay.
It's okay.
I'm Rita. I'm here on the emergency room. This is a 5-year-old child who was admitted for maybe a septic shock. He has a story of leukemia. We did analgesia and we started bolus for correct the hypotension. We think it is a septic shock, maybe in a child with leukemia. We have already called the anesthesia to help us with the airway, and we did ceftriaxone to correct the infections. Okay, our recommendations are monitoring the ER and the blood pressure, and call the oncologist group of the East Hospital to help us to manage the patients. Okay.
Okay. Now in Portuguese. Por favor.
In Portuguese?
Okay. 30 seconds. Okay.
Ok, então nós fomos chamados à sala de emergência por Nós fomos chamados à sala de emergência por um rapaz de 5 anos com acidentes visuais de leucemia que deu entrada com um choque, aparentemente um choque séptico, estava hipotenso, tinha petequias. É uma criança que está sob protocolo de leucemia, portanto está imunossuprimido. Fizemos-lhe bolos para corrigir a hipotensão e administramos de ceftriaxone para tratar uma possível infecção que ele possa ter.
Tudo bom. I can understand some Portuguese, but not when she speaks Portuguese.
Thank you very much.
Okay, so now we go next door. Think of one thing good in one department that you're in the emergency department to receive him.
Okay.
Okay? Okay. Lifeguard is here, baby is here. Ready? Go.
Yes. First look, seems conscious. Sembra cosciente?
No.
No? Ok, verifichiamo che non sia cosciente.
Bambino, mi senti?
Not conscious at all. Ok, partiamo con il CRP. Ok, polso, respira.
Non lo sento e non vedo respirare.
No pulse.
Ok.
Tavola rigida. Ok, partiamo.
I'll go with the intraossa.
Okay.
Did I take it?
Ok, siamo in arresto. Prepariamoci a valutare il ritmo. Posizionata. Analisi, ok. Via. Ok, non definitivamente ripartiamo. Abbiamo un accesso?
Yes, we have. How old is the baby?
5 years old.
5 years old.
Okay,
12 kilos.
Okay.
20 kilos.
Ok, quindi facciamo adrenalina 0.1 ml, risoluzione diluita 1 a 10.000.
Okay, so I'll give some 2 milliliters of the diluted solution of adrenaline, epinephrine.
2 ml, how much?
It's 0.2 milligrams.
Milligrammi sono 0.01.
Esatto,
Un
quindi
chilo.
20 kg.
Ok, prendiamo un accesso, poi se abbiamo un accesso facciamo degli esami e passiamo alle cause secondarie. Facciamo anche un bolo, se possiamo, e le AB, esatto.
Okay, so I take exams and hemographs, it's not taking
Ok, we just one.
Abbiamo una intraosso.
Un intraosso, sì, esatto. No, bisogna cercare
Did I take the second intraosseo?
You have 2 intraosseous.
Okay.
And you draw blood?
No, I'm asking you, did I take it?
Sure.
Okay, perfect.
Okay,
Now, I'm drawing blood for the hemogas and the exams.
Ok, adesso iniziamo il
The
bolo.
nurse says, can we send the blood from the intraosseous or it has to be from the IV? Is it okay to send it to the lab?
It's okay.
At this point, yes. Vanno un po' di 10 per 200 ml, 200 milliliters of the physiological solution.
It's been 4 minutes of CPR.
4 minutes of CPR. Ok, allora dobbiamo controllare il polso dell'CP. Presente? ok? Pronti alla valutazione del ritmo?
Valutare il ritmo.
Ok, valutiamo ancora a polso? C'è polso? No, ok, resta in assistolia, quindi non è defibrillabile, continuiamo, ripartiamo.
Vado con un altro
Secondo ciclo, quindi abbiamo fatto, siamo in arresto, cambio circolatorio, non defibrillabile, abbiamo fatto una adrenalina, bisogna prendere le delle avanzate, esatto. Stiamo facendo un buono di soluzione fisiologica, abbiamo fatto un'adrenalina, esatto, stiamo aspettando l'EAB, possiamo pensare ad altre cause reversibili.
Glicemia l'abbiamo fatta?
Quindi glicemia e temperatura. Glicemia e temperatura 34, ok. Abbiamo bisogno di riscaldare.
30 seconds it will be back. It's
Okay.
like we're finishing.
Ok, dobbiamo riscaldare, provare a riscaldare i liquidi.
I can change it with warm the fluid if you want.
Yes. Poi la temperatura di glicemia.
Sta arrivando il 25.
200. 200.
Ok, questa glicemia non la usiamo. Poi siamo
We have the Emogas.
pH 7.00.
Okay.
PCO2 100. PCO2 100. Venous blood gas VO2 25. Base deficit minus 12.
Ok, acido disparata. Ok. So, andiamo. Andiamo a carbonare.
7 minutes. 7 minutes of CPR.
7 minuti of CPR. Sì, esatto, e poi facciamo un bicarbonato.
With compression.
Dimmi quando devo bisogna ricontrollare il ritmo. Ok, scorda.
Chiudiamo polso non presente e sempre sistolia. Ricominciamo. Ok, adrenalina.
I administer 2 more ml of epinephrine.
Okay, second dose of epinephrine.
Yes. E poi
20 milliequivalents of bicarbonato.
20 milligrams of bicarbonate.
Yes.
in 10 qua.
L'altro processo.
Va bene?
The bonus I think is finished.
Sì.
We are at 7 minutes.
Okay.
You want another one?
Yes, I want another bonus. Ok, sempre 20 ml. Ok, pro chilo.
So I
5
administered
minuti.
200 milliliters of preheated
You're starting to move a little. You're moving a little.
Ah, ok. Polso c'è. Ok, occhio, si sta probabilmente vomitando, controlla se l'elettribilità esiste, se bisogna aspirarlo. Il polso c'è ancora? Polso è presente, ok, siamo in rosso. Ok, quindi ripartiamo dall'ABCDE, vai Matti.
Tirare il pezzo aspirato.
Ok, vedere se sono pelvi. Abbiamo una saturazione. Sì, sì, già chiamato l'animatore. Ok. Benissimo, allora, quindi abbiamo fatto la A, passiamo al B.
Saturazione.
86, noi stiamo dando 100% of oxygen, ok, stiamo continuando a ventilare. Non rifiuta il
Lung secretion.
lung aspiration, ok, the spiral. It doesn't refuse the tube, ok. Quindi andiamo avanti col B. Ok, siamo al 99%, va bene? Senti qualcosa?
Ok, let's time out.
Ok.
Okay. Ready to record it?
Posso dirlo in italiano? Mi sono un po' lenta. Ok.
Bambina 5 anni, 20 kg, annegato. Arrivato in arresto cardiopolmonare, controllato il ritmo non defibrillabile, eseguiti tracini di RCP, poi ritmo non defibrillabile, somministrate 2 etni. Poi è arrivato a questo punto il ROSC, attualmente sta siamo avanzati il paziente, ha delle diaree avanzate, avevamo anche mandato degli esami, ma stiamo ancora aspettando l'esito. Sicuramente il ricercatore dovrebbe valutare il sistema cardiocircolatorio e eventualmente mantenerlo con delle linee. E anche le 5 per valutare eventuali confusioni e leggi del principio cognitivo per valutare eventuali confusioni e esiti.
Okay. And how can you try it in English? Slowly.
Okay. 5-year-old boy, John, arrived here in cardiac arrest. We checked the rhythm, was not shockable. So we have done 3 cycles of CPR and 2 doses of epinephrine. Then he got in bolus, yes, 2 bolus of physiological solution. Then he got in ROSC. Now the patient is not really conscious, it's unconscious, and have advanced airways, and we are waiting for the exams, but we don't know if it's probably it's not a compensatory shock, it's in shock.
Okay.
They have called the
what is the vascular access that you have now?
2 intrances.
2 intrances. And is the family with you?
No.
Are they on the way?
We didn't have them yet.
Okay. So now we go and we'll do the other team, then we'll go back over.
Thank you.
Very
Thank
good.
you very much. Thank you.
Did they look for H's and T's?
For what?
H's and T's. Hypothermia.
I didn't think they did. So Sarah, when they gave the report, did she say pulseless electrical activity was the first rhythm or asystole was the first
She
rhythm?
didn't say, she said only not shockable.
Not shockable, okay.
She didn't say which one.
But what I heard, the team leader, I think I heard the team leader, the person interpreting this, initially say it's PEA.
Yeah, PEA.
They said PEA,
Yeah,
right?
but that's, I didn't know what it means.
Oh, okay.
Pulseless electrical activity. It has an electrical rhythm, but no pulse.
Yeah, they said PEA. You said that
That's what I thought.
Which is,
you said the correct.
but which I think they were misinterpreting that when you're doing CPR, right?
That's why I want to make sure we can debrief that. Okay. Are we good?
But you should have switched out compressors earlier.
Yes.
And the patient is now sleepy and brings the patient to the emergency department. The lifeguard drops the patient for you, 5 years old, coming, a lot of secretions and not moving. Okay?
Okay. Is the patient responsive?
No.
Very
No.
the pain?
No.
No. Okay. Is the patient bleeding? No, it's not. Okay. And what's the color of the skin?
Bad.
Pale. Okay, second pose. I don't feel the pulse. Okay, start. Do I? I don't feel the pulse. I start CPR. Okay, start CPR. Very good. Just bring me the start. Okay, Victoria, let's go with CPR. Laura, activate patient. Julia, let's
monitor the patient, don't put the drugs, and you can put the access.
Yes.
And Mary, can you help me with these things? Okay. Let's start with the. Are you ready with the monitor, Julia? Okay. I place the tabs. Okay. Perfect. Okay. First, let's focus on the quality CPR in the first 2 minutes.
Okay, I'm raising the tabs, stop the CPR, and check the rhythm.
We asciugato il bambino.
Yes. Okay, so assistantly, there's no pulse. Okay, so start. It's a non-shock rhythm. Please restart with CPR, and okay, now we have to focus on the quality of CPR.
Okay, guys, we have patient in cardiac arrest. So in first minute, focus on quality CPR.
Do we have the access?
Completely.
Okay, I'm going with an IO.
And please tell me when you are tired, so we have to switch, okay? Okay, perfect.
Release completely. Good.
Can you put the
Not there, not there.
Yes, I put the buttons. So you can follow the rhythm if you want. You have.
Now yes.
Okay, perfect. So I have a central line, okay? So let's be ready with the
Nephrine is ready.
Okay.
1 to 10,000, 0.1 ml per kilo.
Perfect, as soon as possible.
How much is that?
0.1 ml.
The nurse wants to know how much. How many mLs and how much dose?
0.01 milligram per kilo.
How much is that?
Okay.
It's
0.2 ml.
0.2 ml done flash.
Okay.
0.2 ml.
This is good during the
Oh.
CPR.
2 ml, guys.
2 ml, 0.2 ml.
Done okay?
Okay. 30.
Okay, good job.
To the next rhythm check.
Okay, right. If it's possible, I would like to have Arterius
The next rhythm check.
Okay. Okay.
I'm going to try.
Perfect. Laura, does the patient has much secretion? We are starting.
We are functioning.
Okay. Perfect. And then as a gastric tube.
At the next rhythm check, we will concentrate early and
Perfect.
10 seconds to the next rhythm check.
Okay. If you want, I can prepare a focus to do it.
The focus is in about 5 moves down. You have to get it.
Next rhythm. I took the pulse.
Okay.
I will feel the pulse and insist a history. So we start, switch the position, and we start with
I call PQ for help. Okay. And I call one of them to take a focus for
They're
help.
going to get the focus for you, but you have to call the PICU and Daniela is the PICU doc with the translation.
Do you have any dots? Do you have any dots?
Yes. pH is 7, venous blood gas, 7.00.
Okay. We have
The PCO2 is 100.
100.
CO2,
Okay.
100. Venous blood gas PO2, 24.
Okay.
Base deficit minus 12.
asynchronous.
Okay.
200.
Julia, please, can you put
Sodium 130. Sodium 130. Yes.
for the antidote.
Ionized calcium.
We
is
can
normal.
ventilate asynchronously
Yes.
with the
Potassium is 5.0.
5.0.
Okay. Okay, let's go on with each. Okay, each 3 minutes. 0.01 milligram kilos, so 0.2 milligrams, so 2 ml of distillation. Okay,
We have 1 minute.
Okay, we need to correct the ventilation because of the physical goal of the patient is 100. Okay, so 100. You have a laryngeal?
Yes, I also put it a nasogastric tube.
We are filing
we
as
are
far as possible.
yes, yes, we aspired before, and we are also asking for the entitled CO2.
Perfect. Okay, very good.
CO2
And my that's it.
is good.
Okay,
10
perfect.
seconds to the next rhythm check.
Okay, did we call the video?
Yes, I call it is coming in 10 minutes.
Okay, perfect. And we need a body temperature. Okay.
Stop. Next.
It's
Stop compression, check the rhythm.
Okay, perfect.
Okay, there is no pulse and this is asystole. So we start to
Guys, I think that we have to Is warming the patient.
Warming the patient because low temperature is a cause of cardiac arrest.
Okay.
I've done the warming
Perfect.
Can you check the pulses during the CPR so that it's good that the pulse
During PCPR, yes.
Okay. Okay. Good. Are you tired?
No, I'm okay. This is the max frequency, yes. You can follow the medication of the drawings, okay?
Is the patient drawing in salt or sweet water?
What's the name? Sweet one.
Sweet water. Okay. Okay, guys.
He's starting to move a little bit and cough.
Okay. Stop. It's coughing.
Yes, stop.
Okay. Stop compression and the remove the
Now he vomits.
Okay. Let's put the patient in a security position and continue to aspire the patient.
Maybe we can put a cervical
The cervical collar as soon as possible, yes. Okay. Okay. Okay, guys.
Do you want to recover?
Okay. Please, after the aspirate this action, put hydroxygen with rotating mask for supporting him.
Okay.
Or
and
let's check the breathing because it's possible you will need a positive pressure the airways like a CPAP. So let's try in this way. Now guys, let's be focused on the post-stroke management. Okay. So for brain protection, we can start with hypertonic bolus, 300 kilos.
Okay, I'm preparing it.
3% sodium, and then
now you have to do a pressure.
okay, try this. Okay, the saturation is not improving, so we have to escalate the airways. I think it will need a positive pressure, like CPAP.
Yes.
Okay. And what's the neurological state of the patient?
The abilities are reactive. I just checked it.
Okay.
And is
Now is it responsive to? Is it responsive now? Later to pain. Okay.
reactive.
And the temperature is still support. Okay, we need to warm it.
Maybe the fluids we can.
Okay, we just put the metal.
Yes.
Okay, we can give him warm fluids or bottles of normal saline warm. Okay. If we can put that at 30 degrees, but not. Okay, check the pulse. Check the pulse.
I feel febrile.
Okay, do you feel the pulse? Okay, perfect. Perfect. Okay. It's the
Moving a little bit. He's also moving a little bit. Coughing a little bit.
okay.
Functioning.
It's possible that we don't see a saturation because the patient is very cold. Okay, so let's try to warm the
Let's time out.
Okay.
Can you leave that up? So can you get that back or no? In English or in English? Wow. Okay. Ready? 30 seconds?
Yes.
Okay. Let's go.
So we have a 5-year-old baby, 10 kilos, presenting with a cardiac arrest with non-shockable rhythm due to a drowning. We supported him. We started CPR and we gave him 2 epinephrine, ROSC at 5 minutes after warming the patient. All the electrolytes were good at the blood gas. Plan post-ROSC management and PQ admission.
Very good. Okay. I want to point out one thing to you. At the end, he had no pulse ox, but he had a pulse.
Yeah.
And just before, he had a pulse ox, the same temperature, the same condition. What do you think happened? Could be hypotension. That's important.
Could be.
What else could be? Look at the baby. Look at the baby. What happened?
Started moving.
No. Look at the left arm.
Okay.
What happens when you check your blood pressure? What happens?
Yes.
The pulse ox goes away. You have to change the pulse ox to this. Okay?
That's right. Yes.
It wasn't, I didn't do that as a trick. It's real life.
Yes.
Real life. It's not a trick of the games. It's a real life thing. Yeah. Okay, good.
Thank
Then we're
you.
going
Thank you. Thank you.
Because he's very swollen and he's not making very good urine and he's getting very tired and complaining that his stomach hurts and his chest hurts and he wants to sit up. He doesn't like to lie there. He wants to sit up. Okay? Ok, Antonio.
Va bene, abbiamo Antonio, un bimbo di 5 anni, quindi vediamo.
Mama, can I sit up? Yes.
Ok, sì, sediamolo.
Ouch, my stomach hurts.
Sediamo.
Hurts. Ouch.
Sediamo tutto. Quindi prova la valutazione. Sì.
Mamma.
La mamma è qua.
Vediamo la mamma.
La mamma vedete, iniziamo a monitorizzarlo. Marta poi deve avere.
My chest and my belly it hurts.
Ok, adesso tranquillo Antonio che ci occupiamo di te. Vai Marta, vai.
He wants to know what are you doing? What are you doing? He wants to know.
Stiamo mettendo i sarà monitorando. Posizionato per vedere la pressione, le biere come sono? Airway.
Open and stop your chest and have some water. Once you have some water.
Passiamo alla valutazione del PSG.
Ok, passo alla valutazione B, osservo come sta respirando, ha segni di distress respiratorio, rientramento.
28 per minute.
Ok, alla valutazione ci sono segni di enfisema, cutaneo, no? Ok, passo all'auscultazione.
Allora,
ha delle extrasistoli sopraventricolari, la pressione è buona, verità 100 su 60 e la saturazione è 97.
He's very thirsty. He wants a glass of water. Can you have some water?
ok, adesso per un attimo, aspetta un attimo, chiediamo dell'acqua per un attimo. Prendiamo subito un accesso, facciamo un'ega e andiamo a fare lo sviluppo.
Direi SVP. Accesso posizionato verso destra, sollievo intanto 3 provette, una biochimica, l'emocromo e anche l'estruttore.
E mandiamo in collega a sviluppare.
Respiro bilateralmente trasmesso, non deve scivolare, la frequenza respiratoria, vado con il polso, periferico, ok, prendendo i posti sono, la pressione è quella lì, ok, refil capillare,
He's very swollen. Okay, now he's not.
Ok, inizia il massaggio, Chiara. Andiamo il resto, ok? Attacchiamo.
14, 15, 1, 2,
Ribaltiamo il ritmo.
Ok, una fibrillazione ventricolare.
Ok, ritmo ventricolare, ragazzi. È un ritmo ventricolare, qui iniziamo a preparare i farmaci, prepariamo l'adrenalina.
Ok, 1 milligrammi proprio, siamo a 30 secondi.
4, 5, 6, 7,
Il profondo,
9, 10, 11, 12, 13, 14.
Via tutti, mi preparo a scaricare. Scarica erogata.
Vai, prendiamo subito il massaggio.
30 minuti.
Nel frattempo ho preparato adrenalina, pesa 18 kg, quindi 1,8 ml.
Ok, vai, fagliela subito.
Ok, eseguo adrenalina e flash di soluzione fisiologica. 1,8 ml.
14, 15.
1, 2.
Ok, 1, 2, 3, 4, 5, 6, 7, 8, 9,
Ok,
10.
va bene. Allora, iniziamo a preparare un amico defibrillabile, per cui iniziamo a preparare la polverone, 5 mg pro chilo,
7, 8, 9,
e alla prossima scarica facciamo una dose di amico.
2. Pronto per la scarica?
Bene, intanto lasciamo, hai ottenuto qualcosa, qualche informazione?
Sì, no, è solo Siamo a un minuto dalla scarica.
Per cui potrebbe avere un problema addominale, non ha allergie, prende la clonidina come farmaco.
Ok, perfetto. La sua patologia di base?
1 e insufficienza
Dovuta da richiesta.
Ok, no. Nel frattempo io ho preparato una parola. Ok, perfetto. Sono 90 mg. 1, 2,
Prossimità della prossima scarica e facciamo un po' di
9, 10, 11, 12, 13, 14, 15.
30 secondi la prossima volta.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Ok, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Ripartiamo il ritmo.
Cambiamoci.
Allora, insufficienza renale, ragazzi, l'anatomia.
Siamo ancora in rilascio ventricolare. Mi preparo la seconda scarica. Via io, via voi, via tutti.
Vai, riprendiamo la...
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Via io, via voi, via tutti,
Via l'ossigeno. Ok, facciamo il secondo miodarone.
Allora, somministro miodarone 90 mg pro chilo in flash.
Perfetto. Riesce a portare il tuo acqua della via aerea avanzata e chiari prepariamo la seconda dose di adrenalina.
So labs have come back. pH is 7.1. CO2 is 65.
Allora tu continua perché io
PaO2
metto una scala.
is base deficit is minus 20. Potassium is 7.5. Sodium is 120. Calcium is 0.9. Low limit of normal for this ionized calcium in this lab is 1.15. So low ionized calcium.
Ok,
Abbiamo scelta di Tyler.
Glucose is 190.
allora ha una iperpotassemia 7.1 e un'ipocalcemia. È in arresto.
He's moving a little bit and coughing.
Polso presente.
C'è. Al polso.
Ok.
Andiamo sul rosso.
Sta rifiutando la maschera.
Ok, allora tolgo la maschera.
The lab calls back to say that the potassium value is 75. They call it an emergency value. They wanted to make sure you heard it.
Ok, sì, abbiamo visto che il potassio è 7.5.
Chiamiamo il rianimatore.
Trattiamo l'iperpotassemia. Siamo nel rosso, però prima trattiamo l'iperpotassemia per facciamo sollevato il capo,
Sì,
perfetto. Continuiamo con
Sto vedendo solo
per l'iperpotassemia abbiamo da fare un ruolo di calciogluconato al 10% per stabilizzare le membrane, dopodiché facciamo l'insulina più glucosata per far rientrare il potassio all'interno delle cellule.
Nel frattempo posso fare.
Esatto, mentre Chiara prepara i farmaci procediamo con il rosso.
Okay, let's stop there. Okay. Okay. Who's recording? You're recording. Take a moment. Take a moment. Okay. In Italian or English?
Italian.
Okay.
Hai stato Italian.
Okay.
Allora, un paziente con insufficienza renale per anomalie renali e a seguito successive infezioni delle vie urinarie con dialisi peritoneale, che da qualche giorno era gonfio, stanco e non respirava bene, aveva anche male allo stomaco. La dialisi sembrava non funzionare molto bene. È arrivato, gli abbiamo messo l'ossigeno, dopodiché è andato in arresto, non ho visto il ritmo perché stavo facendo, era un'estasistolia ed era proprio...
Turn around. Now, you're on the phone?
Okay.
You're calling the floor to tell them about the patient. Okay, you're calling the word, okay? Okay, start over again, all over again. Okay.
Ho un paziente con insufficienza renale e diagnosi peritoneale, qualche giorno stanco, gonfio, non respira tanto bene e aveva male allo stomaco. È arrivato, gli abbiamo assistito alla respirazione con l'ossigeno, dopodiché è andato in arresto, era un ritmo defibrillabile, quindi abbiamo fatto 2 scariche, una prima dose di adrenalina e una prima dose di amiodarone, dopodiché abbiamo ottenuto il ROSC, abbiamo scontato che abbiamo iperpotassemia, quindi stavamo per avviare il volo di calcio gluconato al 10%.
Question: have you treated the hyperkalemia yet?
Not yet.
Not yet.
We are going to.
How are you going to treat it? How do you recommend that we treat it?
Calcio gluconato al 10% e successivamente avremo dato l'insulina più la glucosata. E anche l'aerosol col salbutamolo.
Okay, okay, good.
Sinistra che c'è l'aria, quindi siamo noi, sinistra che c'è l'aria.
Like didn't really pay attention to the test. They take time to pay, and someone will call came back from the home that this is an emergency, or will switch to say okay. Because I felt like they were missing the potassium.
I kept on saying they couldn't do dialysis. 2 people asked me the same question.
Yes. Yeah.
And I kept on saying she had such a bad abdominal pain, I couldn't do the dialysis. Yeah, last question's like, at normal anatomy, why does he need dialysis? At normal anatomy, I mean, I'm unable to be for hypertension. You know what I mean? Like, there's a lot of extraneous stuff. But 2 different people asked.
Do you have the same impression?
Yeah. Yeah.
So recognize.
So, you know, what I couldn't see was like they asking questions what they really looked like.
There were a few extrasystoles, and then
I could have gotten mine much earlier, right? I mean,
yeah, or not, although in real life. But it just okay. All right, I think we are ready for Sapienza. You're from Sapienza? And he's complaining of a lot of chest and abdominal pain. He, many months ago, had a kidney infection and has been on dialysis at home, peritoneal dialysis. But today, he has chest pain and belly pain, and he's very, very tired. So he comes in and comes to the hospital, and you're there to see him.
Okay.
And he's complaining, my stomach hurts, my chest hurts, can I have some water?
Okay, so guys, we have a 5 years old with chest and abdominal pain. And
Can I sit up? Can I sit up? Can I sit up, please? Can I have my mama? Mama?
Thank you. Don't worry, Tiger.
I want to sit up. I want to sit up. Thank you.
Don't worry. Is awake.
Yeah, I just feel like my stomach is really hurting. My I'm breathing fast, but it's not my breathing, it's my belly and my chest.
Okay, and how about the skin color?
It's what it is. It's pale, but it's how I look. Yeah.
Okay, so guys, let's put the monitor. Let's start.
Wash my eyes. You're putting your hands on my eyes.
Sorry, we're here for you. Just like you. So, abbiamo spedient.
Sorry?
Abbiamo spedient.
I'm talking, yes, I have, like I've been having to spit a little bit, but otherwise I think my airway is okay.
Let's brush the child and we can start.
I'm concerned about the heart rate. It is quite bradycardic for it.
Ale, can we do in Fiji the while of the evaluation? Okay. Let's do all the evaluation in the
La valutazione a destra mi viene un po' ridotta rispetto a sinistra.
Corretto.
The right lung penetration seems.
No, it seems pretty equal. It's okay. It's pretty equal. I may need a little translation.
Okay. And any retractions?
No, not really.
No. Okay.
Just
the
fast breathing.
The function of the chest is symmetrical. Yeah. Okay. And something about the saturation.
Saturation is good. It's hypnoic, and the pressure is okay for each.
Okay.
My stomach hurts.
Okay. And what about the rest of the time?
About 3 seconds.
Okay. And Marty, can we prepare paracetamol?
Oh, my chest hurts.
Don't worry, don't worry. What about the breathing?
Okay, I have a change on the monitor.
Now it's not moving.
I have a change on the monitor. It's a disorganized rhythm, so check.
20 kilos. Okay, no pulse. It's correct. Alessandro, double check for me.
I don't feel a pulse.
Okay, we are board, CPR board.
Yeah.
Can we call the ICU, please, and start CPR?
So it's talking like
I'm calling the ICU. We have a 5-year-old boy, 20 kilos. We have a ventricular fibrillation, and we are performing CPR. So please come.
10 minutes.
Sorry.
10 minutes.
Sorry?
10 minutes.
Okay,
I see you're busy.
Yes, thank you.
Yes.
10 minutes for the arrival of ICU.
Okay, so we have a 5 years old in cardiac arrest. This is a non-shockable treatment. So
It is a shockable rhythm, sorry.
Sorry?
It's a
Okay.
ventricular fibrillation.
Okay, sorry, this is a shockable treatment. So whenever you're ready, we can deliver the shock.
So did I manage to have an access, an IVU access?
Yes.
Thank you. Okay, thank you.
I'm charging to 2 joules per kilo.
Yes.
Okay, so what's the weight we think?
Weight is 20,
So I'm going to 40, or if I have to attend this 50.
Yes, 50 is okay.
I'm charging
50 is okay.
Touch the part. Touch the part. Stop.
Go guys, push hard and push fast. Charging. So let's continue CPR. Let's prepare the penetrating is ready.
It's charging.
Okay.
Okay, it's charged. I'm going to shock on 3, 2, 1, everyone out. Shock delivered.
That's perfect. We continue the CPR. That's okay. So this is a shockable rhythm. So we do 2 minutes of CPR. In 2 minutes, we reevaluate the rhythm. If the rhythm is still a shockable rhythm, we can do a shock for double. We can double the dosage, and we do a bit rate. Okay. And after the second shock, we can think about an advanced airway. But if the ventilation is okay, I think that we should go with that. And can you check?
Yes, of course.
So everything is ready. 0.2 milligrams. That's perfect. Cheer and let's administrate after the second shot. Okay? So what about the analysis?
I'm going to.
Oh yes, okay. And okay.
Ventilation good?
Yes. Okay. So what happens?
It's not very good.
His stomach is getting bigger.
Okay. Okay, so he is a 5-year-old boy with kidney infection and swelling. So since today, can we take a blood check? Yes, sure. Can we check temperature? Yes.
Temperature is okay.
And Alex, which was
The stomach is going bigger.
Yes.
So I think we can consider
Yes. Alex, can we take a gastric photo for
It takes about it takes about 1 minute in the machine, and also you got blood.
Yeah,
It's going to take a minute or 2. It got sent to the lab, and we'll be back in a minute.
Okay, thank you very much. Thank you. Okay, so I think that we should continue.
Oh, yes, right.
So did the boy have lesions? And what about the skin? He has an edema of the leg.
Yes.
All of his swollen.
All edema.
So I think that we should call the
I can't do dialysis.
and I think that we should yes. Okay, yes. So what about
5 seconds to the next re-evaluation of the rhythm.
Okay, I think
The
that we
blood
should.
gas is back. The blood gas is pH 7.00.
Okay, guys, I'm ready. 3, 2,
65.
1, go.
Potassium 7.5.
We got disorganized rhythm.
0.9.
So I'm going
for the lab
to shock
greater than 1.15.
Okay, guys,
Sodium 130.
Okay.
disorganized rhythm. We checked, so I'm going to shock 4 joule per kilo, so 8. Okay, I'm charging.
Okay. Do we have furosemide in our hospital?
Do you have what?
Furosemide?
Furosemide? Yes.
I'm ready on
You can make it up with
2, 1, oxygen out, everyone out, don't touch the patient, shock delivery.
That's okay. If something is CPR and Marty, sorry, yes, can we administer the epinephrine that we
Yes, I prepared 20 milligrams of furosemide.
No, sorry, I do mistake. Can we use epinephrine?
Yes, the epinephrine is ready. So it's 0.2 milligrams of epinephrine, ready to administer.
How much is that?
And dialysis visits today without dialysis. So I think that we should call the nephrologist
Yes. And title is in?
Okay, so
And title?
sorry, it is hyperkalemia. Okay, he has hyperkalemia and so I
Yes. I see a title of 32.
one of your patients.
Starting to move a little bit.
Already we have done 2 shots.
he has hyperkalemia, so we have
Okay, so calcium gluconate is ready.
the level is 0.5 milliliters per kilo.
Right, so it's 10 milliliters.
Okay, then we can start the calcium gluconate.
Okay, so ready to administer calcium gluconate in 5 minutes.
Can I update you?
I'll do update
7.1.
Let's do a quick recap. We did such a good job. Let's do a quick recap. Yes, this is a 5 years old in Rosk. We had a cardiac arrest, shockable rhythm. We performed 2 shock and 1 with epinephrine, and now we are in Rosk. So let's continue ventilation, and now we can restart the evaluation. From the lab test, he has hyperkalemia.
Okay, let's start. Let's stop there. Okay. Now the ICU just called back, and they would like from the recorder to have an S-bar, 30 seconds. Okay. She's calling the ICU.
Ah, okay.
S-bar?
We have a 5-year-old boy now in Rosk after a non-shockable rhythm, shockable cardiac arrest, and he has hyperkalemia. It is a boy that got dialysis for kidney failure, and we performed CPR for 5 minutes. We administered 2 shots, 1 dose of epinephrine, and we also tried to correct the hyperkalemia with calcium gluconate. We would like to leave him in your ward. He has an intravenous access. He is now in Rosk. We recommend you to keep the saturation between 94 and 99% to maintain the cardiovascular system.
Okay, it's time there. Danielle, any questions for her from the ICU? Okay. Okay.
Ok, abbiamo
and he has past history a few months ago of getting a kidney infection, and he's been at home on dialysis. But today his belly is hurting a lot.
Ok, è ancora in dialisi, l'ha fatta 2 mesi fa.
He's still on dialysis.
Still on dialysis, but at home, yes.
Ok, è un bambino che fa dialisi di 5 anni, quindi peso stimato 20 kg, che da qualche giorno ha mal di pancia, suda molto e dolore toracico. Ragazzi, ci orientiamo già verso una miocardite, però analizziamo tutto con un fatto. The baby is ill.
Ah, yes, I'm thirsty and my chest hurts and my belly hurts. Can I have a drink of water, please? And can I sit up?
Yes, of course. Il bambino si può mettere comodo con la mamma vicino. Mamma,
can I have my mama?
Yes, of course, la mamma è vicino. What's the color of the skin?
It's pale, but pink.
Can I hear some pathological sound or see pathological sound?
Just a big belly, very swollen. Eyes are almost swollen shut. His belly, my stomach hurts. My chest.
Ok, dolore toracico, dolore all'addome. Un bambino in dialisi molto sudato? No, molto gonfio, molto edematoso. Ok, abbiamo fatto un pass. Passiamo con la BCD.
And your waist clear?
Oh yes, my airway is okay, but I'm having trouble with my belly and my chest.
Ok, non si cresce. Non si cresce.
Adesso facciamo qualcosa.
Now we have just a moment, please.
Yeah. Can I have a drink of water, please?
No, later.
I'm so
Better
thirsty.
later. I take a towel with water and
That feels better, thank you.
Okay. What is respiratory rate?
Okay, let's see.
28.
Ok, 28.
Ok, 5 anni, 28, sono al limite.
Abbiamo una frequenza di 80.
Frequenza di 80, ok?
Does he have work of breathing?
Oh, just my belly hurts and my chest hurts.
Bilateral.
I feel like sometimes very weak.
Okay. Thorax
I'm going
is
to pass out.
expanding bilaterally. Thorax.
Okay.
Okay.
I think now.
Ok, allora passiamo alla C, quindi vediamo se c'è poco forza centrale, polsi periferici, la pressione, il refill, segni di precarico.
It doesn't feel good to lie down and having trouble
Mettiamo lo
breathing. I want to sit up.
Yes. Ok,
Vuole vescicolare all'aspirazione?
Molto circolare l'aspirazione.
And my heart, it feels like it's beating funny.
Chiamiamo un cardiologo per favore, nel frattempo mettiamo un ECG a 12 derivazioni.
Io comincio a fare una mascherina.
Sì, per favore. Chiamiamo
Chiamiamo il cardiologo.
o chiamare il cardiologo. Ok, dovremmo fare un ECG a 12 derivazioni e un ecopass col cardiologo appena è arrivato. Poi per la C prendiamo un accesso dei nostri se riusciamo.
Can I take aspects?
You're checking.
Ok.
6 liters.
Okay. An echocardioevaluation fast, yes, and we done an ECG da girazione per giorno traccio. Abbiamo chiesto un accesso, possiamo fare un test di mega con elettroliti, sodio, potassio, tutti gli elettroliti che riusciamo, facciamo un lavoro con di ECG. Ah, ok, solo
This is one here.
B,
Frozen. And this is
ok. QRS.
Non T. T, c'ha solo questa T.
Ok. Un attimo, calma. Agli esami facciamo anche gli esami di enzimi cardiaci e la funzionalità renale del paziente. Poi repeat la
My chest hurts and my belly hurts.
Ok, prima
It feels like my heart is irregular.
ok, guardiamo adesso, ci vediamo com'è. Leggiamo questi già decisi
Ma non c'è, non penso che me lo fa vedere.
Ok, raga, un attimo, la C non l'abbiamo fatta, i polsi ci sono?
Allora, polsi, centro polsi.
Here's the.
Ok, presente? Allora.
Everyone is 63, it's like that.
Okay, can I ask what's his perfusion?
About 3
It's gonna take a
seconds.
while.
Seconds?
He's very swollen, so it's hard to tell.
Preload signs?
It's hard to tell. His belly is very full.
Very full.
I can't tell where the liver is. It's very hard to tell.
Can I hear some pretzels?
A little bit.
Allora, abbiamo segni di precarico. Quanto è il refill? 3.
Preparo 40 mg di
Considerando che mettiamo un catetere, controlliamo se c'è il diuresi, riusciamo a mettere un catetere vescicale.
Okay. The blood gas comes back, pH of 7.0. PCO2, 65. The PaO2, it was a venous blood gas, is 35, and base deficit is minus 20. Minus 20.
pH 6.0.
7.0.
Yes. Okay.
Potassium, 7.5. 7.5.
Okay.
And the calcium and the sodium.
And the credit pulso.
10, 9, 8, 7, 6, tavola sotto.
Ok, vai, inizia. Vai, inizia, vai.
Mentre voi controllate le recite, cerchiamo di correggere l'iperpotassemia, perché a 7 con alterazione dell'ECG, quindi possiamo fare qualche gluconato in vena, voi
faccio 0,5 pro chilo di calcio gluconato, quindi faccio 10 ml di calcio gluconato.
Vediamo il ritmo a tutti. 10, 9, 8,
ventricolare che si può scioccare, il peso è di 20 kg, quindi facciamo 20 per 4,
20 per 4, 4 giorni per chilo.
quindi faccio 80 giorni.
Ok, secondo linea media europea, appena il carico c'è noi nel frattempo cerchiamo di prendere un secondo accessamento.
Siccome qua non c'è uno per segnare 100,
va bene, no, metti di meno, 70.
sto caricando, ma continua sempre.
Riesco a prendere un secondo accesso?
Can we take a
second access on the right?
Ok, so abbiamo un arresto cardiaco da iperpotassemia probabilmente, abbiamo due accessi di
Ok, grazie.
Glucose is 120.
Non lo so.
Glucose.
Un po' schisto che, glucose 120. Ok, iniziamo il primo ciclo dopo lo shock di RCP e noi controlliamo l'ipercalemia. Oltre il calcio gluconato c'è diuresi.
The laboratory is on the phone.
Yes.
They're calling an emergency value of 7.5 for potassium.
Ok, we have
to make sure you saw the value.
Ok.
Siamo al secondo ciclo.
Quindi calcio gluconato, furosemide e poi mettiamo furosemide e poi mettiamo una cosa dell'insulina con la glucosata. Prepara gli esami quando ci sei. Can we have diuresi? C'è diuresi present?
Urine? No, he makes no urine.
Ok,
faccio 40 mg di furosemide. Insulina, quindi 10 unità di insulina, 29, 6. Preparo 10 unità di insulina in 100 ml di soluzione glucosata, adesso
sì, è la guidata.
somministro l'insulina con la glucosata, fatto
How much insulin?
how much insulin? 10 units. 29, 29, 8.
What else?
Glucose, 10%. How much? 5 ml.
Ora,
29. Si dica per comprare la maschera.
ok, siamo ancora al primo ciclo, fa un po'. Mancano 40 secondi alla fine della allora, stiamo ok, vi facciamo un'ega per controllare il potassio adesso come va. Facciamo un'ega con elettroliti per fare dove c'è.
Ok, sempre in arresto, sempre una particolare di prendi, io adesso li carico, facciamo sempre con lo stesso
sì, sempre con lo stesso joule. E poi per favore accendi anche la temperatura dopo che l'hai fatto.
Preparo l'adrenalina.
Ok, carico via tutto, toglie l'ossigeno, ok, carico, riprendi, vai subito. E ripartiamo.
Abbiamo un bambino che non riuscirà a fare. Perché ragazzi?
Inizia a muoversi il bambino.
Abbiamo un bambino che è dialisi, non l'ha fatta negli ultimi giorni la dialisi, non mangia da un paio di giorni, ha preso anche un antiipertensivo stamattina. Quindi se non mangia ci sarà anche ipovolemia. Prendiamo un volo e poi mettiamo meno mantenimento.
Let's stop there.
Okay.
Let's return to circulation.
Ok, scusa Roche, faccio la pressione. Ok, e stop, perché stai?
Ok. you're going to call Daniela in the ICU to give a bar.
Abbiamo fatto 2 cicli con 2 shock. Al secondo shock si è ripreso, abbiamo corretto l'iperpotassia.
Ok, allora.
Italian first,
30 seconds. 30 seconds. 30 seconds.
Ok, allora abbiamo un bambino di 5 anni che si è stimato 20 kg con una storia di insufficienza renale di trattamento dialitico. Il bambino è arrivato per dolore toracico, per dolore addominale ed era apparentemente edematoso e andava in arresto cardiaco da ipercalemia. Abbiamo portato l'ipercalemia, abbiamo fatto decine di RCP con 2 shock e 2 somministrazioni di adrenalina. Abbiamo somministrato l'acetilconato, furosemide e insulina, attualmente è in condizione di stato in USH.
Noi non abbiamo fatto la generazione, abbiamo trattato solo la potassemia, quindi si è ripresa, perché dopo il secondo shock
Quindi una adrenalina.
I'm sorry, what was the rhythm? I didn't understand.
What is his access now?
The access, okay. To access. Now, with
Your recommendation is what?
We are recommendation the check the electrolytes and we have called
ok, l'abbiamo fatto. Check PSG, check.
No,
aveva chiamato il cardiologo.
Sì, they called the cardiologist.
Cardiologist. And the nephrologist. Okay. Okay, that's good. I just didn't know if you had contacted different people. Okay, now we go next door and we do a little debrief. Okay? Then Monday.
Bravissimi, raga, top. Bravi.
Okay.